Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about basal implants. Let's start. So today I'm going to be talking about basal implants and basal implantology. We've already talked about conventional dental implants in detail in the previous episodes, wherein basically using the element of titanium, that is the metal, which is biocompatible and inert and is it helps in association with the bone, that the bone can grow around it in the form of osseointegration. However, despite the very good success rates of conventional dental implants, there are a lot of patients who have very different kind of cases, either due to some sort of a metabolic disease that the quality of the bone is very compromised, or the bone has resorbed or become atrophied over a period of time because of the lack of teeth, and that is why there is not enough length and width of the bone to house an implant or a conventional dental implant. So this started off in 1972, but now it is picking up pace finally, which is known as basal implants. Now let me explain what the alveolar bone and the basal bone is all about. Your jawbone basically has two components. The surface component, which is the cancellous bone or which is the spongy bone, is the crestal bone or the alveolar bone that houses most of your teeth. But below that is the cortical or the basal bone, which is much more dense. It is a lot less porous and it is very strong. Now what happens a lot of times, the alveolar bone is very susceptible to resorption, atrophy, or any sort of infection or any sort of mechanical change or remodeling due to pathologies or any other reasons such as any sort of metabolic diseases or aging. Now because of that, in a lot of patients, conventional implants cannot be placed because of the lack of adequate width and the length of the bone, and that's where basal implants come in. Now the basal implants, they engage the cortical bone, because of which that the cortical bone is much stronger in density and does not get affected by metabolism or disease or pathologies or age or lack of use, because of which you get very good primary stability. Now primary stability in layman terms is very simple. It is how an implant initially anchors to the bone and how stable it is and how it is not able to move about. Now implant failure generally is considered when your implant starts moving, right? Or if there is infection around the implant, such as peri-implantitis or peri-implant mucositis. Now when it comes to basal implants, the anchorage is so good because it is anchoring in the basal bone or the cortical bone, which is free from all these things, which is free of any sort of defects per se because of any pathologies. And what happens is that the anchorage is good, the primary stability is good, you can get the immediate loading also done, or you can get the loading of the implant with the help of a prosthesis. That means you can chew your food within a few days, or in fact even on the same day in some cases. Also in some cases where the sinus has dropped down or there is the inferior alveolar nerve, you can save any sort of injury to these structures because of the fact that basal implants, the surgical protocol is much different from conventional implants and there is less hindrance of these vital structures. Also there are procedures that can help us to avoid these vital structures while doing the basal implant procedure. Now there are various types of basal implants. You have cos implants, and there's a huge number of basal osseointegrated implants and biocortical screw design implants and various more. And I'm just going to be talking about basically the principle of what we call as osseointegration in conventional implants. You have something known as osseoadaptation in basal implants. In basal implants, the osseoadaptation means as the load increases gradually, the more load that comes onto the implant, it actually helps strengthen the bond between the implant and the bone, and that's why it's known as osseoadaptation. Secondly, there is something known as syncrystallization, which can be done with welding all these implants together, especially in a jaw where there are no teeth and you have to place multiple implants, about 7 to 12 implants, and then you can weld them together. Now they will act as a combined unit and help in resisting any sort of excessive forces that might come while you're trying to chew your food, and they will resist it and at the same time maintain the architecture and the health of the bone. The technique also can be flapless or flap surgery required for implant surgery depending upon the design of the implant. and you have different procedures that can help in protecting the vital structures. Now, the only downside that I would say, in my humble opinion, would be that basal implants might be a little expensive than conventional implants, and they require a lot of treatment planning. Secondly, you need to have a very good oral surgeon or an implantologist or a prosthodontist or a periodontist or just an implant surgeon who knows their way around basal implants and how to go about the surgeries and the maintenance of these implants. So that's it for today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly refrain from calling me directly as I might be busy with the patient. Just drop me a message and drop me your name, your place, and the common oral health problem that you're facing, and within a couple of days I'll get back to you. So that's it for today's episode. Thank you.